Thank you all for coming. We're going to go ahead and begin our third Pushback Against Drug Abuse press conference. I'd like to introduce Ralph Dixon.
Hi there. That was quick. We got involved, I guess most people get involved for maybe the wrong reasons. We got involved because our son, Michael Dixon, and our grandson were involved in the accident that happened on Thomas Street back in March, on March the 23rd. Are most of you familiar with that accident? Yes. Michael really, as far as we understood, we came to understand through a letter that Michael had written, I believe, to a cousin, that Michael first got introduced to drugs when he had an injury. No, was it? I'm sorry. Okay, Carol had seen the letter. He had some wisdom teeth pulled, and he was given a medication. Was that Oxycontin? Vicodin. It was Vicodin. He was given that, and that opened the door for Michael as far as the addiction. We were really unaware of this problem until ultimately what happened was about 6 months before the accident occurred, Michael came to us and he told us of his addiction to heroin. Apparently, as we later became aware, once the formula was changed to a time-release formula, the properties weren't there to support that addiction. And so what happened was Michael, somewhere along the line, was introduced to heroin. And Michael came to us really distraught, sharing this addiction that he had. There was so much anger in him at himself because he said, no matter what I do, I cannot beat this. And he wept about this. And he was so disappointed in himself. He said, no matter what I do, no matter how hard I work, every dime goes to support this addiction. And at that time, we began to seriously look at getting him into a treatment program. Now, there are so many different programs around. The healthcare facility has programs, I guess, to intermediately help, as I understand it. He did some time at St. Joseph's Hospital, where it's sort of like a detox program. But from the people that I talked to told me when a person is addicted to a drug like this, they really need a long-term treatment program. They need to be taken away from the people that they're normally associated with, and that it needs to be long-term to really get off the addiction and get their body to start behaving normally again. Well, Michael ended up the length of time was about 6 months long, and he was up at Winter, Wisconsin in the program at Flambeau Correctional Facility. And you could really see the changes in Michael as you visited him on a weekly basis. Just about every week, as often as we could, we would get there to see Michael. And often his son, Jordan, who was 4 at the time, would go with us. And we would spend most of the day on Saturday visiting Michael. And you could really see him start to change. Where he was sort of flat before and unemotional, now you saw Michael happy again. You saw him enthusiastic and believing that I'm going to beat this. And all the letters to friends and to us as his family were very positive. And he talked about how much he had gotten involved in a Bible study there. He just felt that he was so thankful for the support that he was getting, both there at home. And the day finally came where that treatment program had ended, and that Saturday morning, Jordan, his son, and I drove to Winter, Wisconsin to pick Michael up. I think at 11:15 that morning, we left the Flambeau Correctional Facility, and Michael was just pumped. We got home, And it was a day of family all being together. My folks and all came to the house. And it was just a great day. Jordan was so excited about having his dad back after 6 months. Well, the next day, was that Saturday morning? Saturday morning. We got up, we were out playing in the snow. There was probably about this much snow at the time out of the yard. I was playing with Jordan, Michael came out. We spent quite a bit of time. And then Michael we were all planning to go to a movie later that day, a children's movie with Jordan. And Michael wanted to pick up an MP3 player because he had been working out regularly while he was in Flambeau. And they took off. And what was going to be about 30 minutes turned into a couple of hours. And I was at home, Carol was at home, and all of a sudden we got a knock on the door. Carol told me that there was police officers arriving to the house. And we got a knock on the door. They came into the house, invited into the house, and explained to us that, sometimes their job is very tough. And they went straight to the point, and they told us that Michael had been involved in an accident and he passed. So we were really obliterated at the time. I mean, it was amazing to go from such hope of his ability to kick this thing to his death within 24 hours of being released from a program. And the point that I have in that is just, it's hard for me to sit back and think how powerful something can be, that in just a 24-hour period it can take you from enthusiasm to the grave. And one of the things I was asking, I don't mean to take so much time, was how do you know, looking back, how do you know that this risk exists? And I would say to you that to look for signs like isolation, where you start going into your room and you stay by yourself a lot. Turnover of property, where you're selling things a lot. Flat screen televisions, you're getting rid of your radios, your CD players, things like that. Things because you're needing money. Missing property, cash missing, things like that. But you want to be very attentive, and don't let those things ever pass. If you ever see those or experience those things, be nosy. Pay a lot of attention to that. And I'll stop there and let you guys go on. Thanks.
Wow. Thank you, Ralph, for sharing that powerful story. And I want to thank everybody here today for attending. It's heartwarming to see how many people are interested and involved in this issue and are passionate at trying to find a solution. It's been already 4 months since the AOD Partnership has launched the Pushback Against Drug Abuse campaign. We've heard many things. We've heard about the scope of the problem, including heroin, prescription medication abuse, other illicit drug abuse, and we've heard ways that the community can get involved in those efforts. Things like this today. Something as simple as Facebook. Something as simple as being involved in your community, in your neighborhood, donating to the cause. Those are all things we each can do individually and hopefully influence others to do as well. But the big thing is it's important to take a stand against drug abuse in Marathon County, pushing back against drug abuse. For our third press conference, we are joining in recognizing the National Recovery Month and focusing on addiction, treatment, and recovery from drug abuse. And to that end, we are very honored today to have with us Lori Blanchard, who is Community Liaison and Licensed Counselor from North Central Healthcare, who will answer the questions: what is addiction, and how is it a chronic disease? Who is more susceptible? How can we prevent it? And what is the link between addictions and mental health? We will then hear from Deb Pascotti, Clinic Director of WASA Health Services. She will speak about treatment of addiction, barriers to treatment, relapse prevention, and mental health as a basic need to achieve overall wellness. I don't know about you, but I am always humbled to hear from Ralph Dixon, Ralph and Carol sharing their story. And we will also hear from Luke today, sharing his story and giving some incredible insights on helping us understand the challenge that we all face. And with that, I'd like to introduce Lori Blanchard.
We talk about addiction. The stigma of addiction is strong. It's powerful. Seen for years as a moral weakness or defect, we know more now than we've ever known about the power of addiction. Addiction is a chronic disease. While people make that choice to use initially, there's also other issues that come into play. Some of those factors are genetics, psychological issues, the inability to have or lack thereof coping skills, social issues, peer pressures, and one's environment. All can play a role in addiction. The link between mental illness and substance abuse is strong. Nationally, 1 in 4 individuals diagnosed with a mental illness also suffer from a substance abuse disorder. We compare that to 50% of those who use or abuse substances to develop a mental health disorder. We can no longer dismiss the use of tobacco and marijuana. In Marathon County and the surrounding counties of Lincoln and Langlade, we have continued to see a progression of drug use, abuse, and misuse of prescription drugs. This is worrisome for many community members as well as law enforcement and individuals that work in the healthcare field, as well as family members. Much of the use, abuse, and misuse seems to have a correlation between the use of drugs that some of us in the field refer to as gateway drugs. Studies show the hierarchy of drug use follows a sequence from the use of marijuana and finally the use of drugs that have increasingly addictive power, such as cocaine, methamphetamines, heroin. It also has been noted by many researchers and studies that those who use marijuana, in particularly adolescents, were 2 times more likely to use illegal drugs as young adults and into his or her years. For some adolescents, it may not be his or her first use of marijuana. It may also be the use of prescription drugs that have come from the medicine cabinet. Many times I'm reminded of a story of a young woman, age 15, whose addiction began with her mother. Her mother provided her with a half of a Percocet one day because she was having a headache. She said after she had that Percocet, she felt no pain. She felt great. She continued to use 2 to 6 Percocets a day. One day the prescription ran out. She began to detox heavily. Something like feeling the flu, but 100 times worse. She then sought out more drugs to ease the detox. She began to use heroin, which lasted for several years. She dropped out of high school, she was near death, and then was detained by law enforcement and treatment began. This is just one adolescent. There are many more individuals like this, as well as adults of all ages who struggle with addiction. In order to move forward with the prevention and treatment, one must understand the gateway of usage by individuals who have become addicted. Teenagers who use tobacco and alcohol have and increased risk for abusing painkillers and potentially moving to the use and abuse of hard drugs such as cocaine, methamphetamines, and heroin. Those using tobacco, alcohol, and marijuana prior to age 15 showed increased signs of dependence, and this dependence or risk to abuse substances increases greatly. It is important to understand the progression of these drugs and these substances and how that addiction takes a hold. In order to gain a better understanding of why an individual first began to use and abuse drugs, we must understand the process of the gateway drug usage. The sequence of usage can also be related to social norms. We can no longer dismiss the use of tobacco, marijuana, and alcohol as things that teens just do. The window between the first use and the use of drugs such as heroin and cocaine is closing. Relapse is likely, recovery is possible. Thank you.
Good morning. All right. Well, I'm here to talk a little bit about the fact that mental health is a fundamental need with our patients, with people that are dealing with addiction issues. In order to be able to meet their basic life needs, such as food, clothing, shelter, transportation, everyone has to have their mental health in order. That's important. And the thing is that addiction makes this difficult. Therefore, I think about our community and our treatment services within our area, within Marathon County, and it is imperative that we have, the ability to meet both the needs of substance abuse and mental health services for people that are really struggling with these issues. Treatment options. Well, here we go. I think about the fact that when I go out in the community and I do presentations, I talk about the fact that we do not all come in bunches like grapes, and what works for one person may not work for another. So we have to have many treatment options that are available. For example, we may have, Marathon County has North Central Healthcare and Peaceful Solutions. Those are great outpatient treatment services that provide a sliding fee scale for people that are indigent or have low incomes. Another piece I think about is medication-assisted treatment. For those who are unfamiliar with that is using medications such as methadone or Suboxone or Subutex to manage the physical withdrawal symptoms that patients are dealing with, especially those, particularly those with opiate dependence, and of course the thing that we are seeing most significantly in our area over the last 2 to 3 years is IV heroin use. And so that the medication helps them deal with those physical withdrawal symptoms while they're doing the real work in counseling services. However, we also have some issues. We have right now a real gap in services in our area. And I know Melissa and I have talked a lot about the fact that with the closing of St. Joe's, we lost, in my opinion, a significant resource for our area. Because that was a place where when we had patients that had a need for a higher level of care that our service could no longer meet, that we could send them there to get inpatient services to address whatever addiction issues were going on. And this is especially important for people that are dealing with polysubstance abuse, that may be using multiple high-risk drugs. And I don't want to minimize things like marijuana at all, because I 150% agree. We cannot minimize marijuana at all anymore. That is a gateway drug that we see over and over again. But I'm talking about the ones that put people at risk of death, combining opiates and benzodiazepines, so on and so forth. So that this is something that is a huge gap in our services. Another gap is residential services in our area. I know we are supposed to have that coming. North Central is working on that, but I do know that's a work in progress. And that is it's not just for our community, but for our state. Because one of the things that those of you who are in the field know that Medicaid does not pay for residential treatment options. Only people either funded by their counties or who have private insurance or family members have enough money to pay for that on their own can actually access those services of residential treatment. Looking at things, another huge gap, and to me a very important one, is adolescent treatment services. Currently we have 0 treatment services. And I want to, there's not saying that there isn't some resources out there in terms of outpatient counseling services. However, for example, in this is for adolescents I'm talking about. However, like in our program, we cannot treat anyone under our licensure under the age of 18 years old. Now, that's a problem for me when I have teachers and parents of kids that are high school students, 16 and 17 years old, with 2 and 3 years of history of IV heroin use, that I can't treat them in my program. I have been able to have that changed, and in one case-by-case basis, I can get an exception through the state. However, we really are lacking these services, more intensive services for our adolescents in our area. Relapse isn't inevitable. Addiction is a battle. There's no magic treatment that is 100% effective. And again, what works for one may not work for another. Just like it takes a village to raise a child, it takes a village to help somebody not only achieve abstinence, but maintain it. I think about a term that Melissa likes to use. Much like a duck in a dirty pond, we can take them out, we can help them get cleaned up. And if we put them back into the same environment, what happens? And so it's important that this is a total lifestyle change for our patients, for people struggling with addiction issues. The other piece of it, I think, Lori, you touched briefly on, is the fact that I know in our program, at least 70% of our patients have co-occurring disorders. So not only do they have mental addiction issues, they also have mental health issues as well that have to be treated simultaneously in order to be successful. There was once upon a time a belief that you treated one and then the other. That is not the case. We have to treat both at the same time in order for someone to be successful. And recovery is a road to achieving wellness. It's important to understand that recovery goes beyond the physical aspects of addiction. Overall wellness includes healthy home, healthy friends, education, employment, a sense of purpose, and a connectedness to our community. So as we celebrate Recovery Month this month, I ask our community to remember that behind every addiction is a face. That is someone's child. It's someone's mother or father, sister or brother. They are valued and they're loved. Recovery works, and as I like to tell my patients on the inspiration line at Wausau Health Services, keep coming back. It works if you work it, so work it. You're worth it. Thank you. And with that, I would like to introduce Luke.
Hi, my name is Luke. I'm 26 years old, and I'm a recovering drug addict. I started using marijuana when I was about 12, 13 years old in high school. I kind of dabbled with a little bit of everything, but I tended to go right towards opiates due to, it started at first as I just had simple headaches and I wanted the fastest cure, and that was the fastest cure. It was the fastest cure until shortly after the Vicodin, it went straight up to the oxycodone and all the higher drugs. And it didn't take long, like Mr. Dixon said, that the formula changed and they made it almost virtually impossible for you to still get that high that you wanted. And that's unfortunately when heroin came into my life. It didn't take very long for me to realize that I had a problem waking up mornings, day after day after day, not being able to do anything, eating to just basically normal hygiene, opting out of family events, not wanting to be the son that my father wanted me to be, and that continued on for a long time. I did a lot of things as a child or as a teenager that I should have continued to do, like Boy Scouts and sports, but once you fall into that path of addiction, obviously can't quite continue to do both worlds, so I just slid into the one world that I only knew. I went in and out of rehab a few times in treatments, and the reason they didn't probably work for me so much is because I didn't fully 100% want it in my heart. But at the same time, getting thrown for me into a facility and then getting let go back into the same world that I had only known, and the same friends and the same people and the same environment was my worst, because I just went right back to it. There was no change for me. I had to change everything. I had to change my friends. I had to stop talking to my friends. I had to be aware of everything around me at all times and know that I'm in control of it, and if I'm not, then I'll go right back to that. For me, going to Wasatch Services was probably the best for me, because they're a combination of the intense treatment that I had and the way the counselors are there. They were great with me. That finally pulled me out of the rut that I was in and didn't ever think I was going to get out of. Finally, then, my son being born 2 years ago was probably the best thing that could ever happen to me, because him being born was like bringing a new life into the world, but it was also a reason for me to completely start over and have a new life and be able to live that life with my son sober and keep staying sober, because if I'm not sober, then I'm not going to be the best dad that I can be. And you know, I think the biggest thing that for my family and a lot of the people in the community is ignore. This is a problem that will never change if it's being ignored. There's so much of it going on, and family support and just community support, just doing more positive, sober things is what I think really will continue to keep people sober. That's all I have.
Thank you. We want to thank all of the presenters today. We want to thank Ralph and Lori and Deb and Luke for sharing your stories and giving us more insight into the problems we face. We also want to thank our media partners and all of you for attending today's presentation. It means a lot and keeps us moving forward. On behalf of the entire AOD partnership, I would also like to thank North Central Healthcare for the use of this fine facility, the Judd S. Alexander Foundation for their generous investment in the Pushback campaign, and for Kirk Howard and the Kinsey Green Marketing Group for all your hard work. Without all of these partners, Pushback would not be possible and would not have taken off in the way that it has to this point. Now, please understand, we don't want to have stories that show the need for efforts such as Pushback, but we are thankful that our families, our friends, and our neighbors are willing to do so. Our entire community plays an important role in sobriety, whether you know someone who is struggling with addiction or in recovery. In conclusion, we know that prevention works, treatment is effective, and people recover. For more information about the Pushback campaign and what you can do to get involved, please visit pushbackdrugs.com. That's pushbackdrugs.com. It's time to end the stigma of addiction. It's time to embrace recovery. It's time to push back against drug abuse. Well, thank you all, and please visit the website. Please do what you can within the community, and please continue to support Pushing Back Against Drugs. Thank you.